Dr. Pooja, please let me know when you're ready.
Yeah, I'm ready, ma.
Noted, noted. We'll just wait for a couple of minutes and then we begin.
One moment, Cochrane corporate. Just show you the PPT. The paper is, I think the official actually.
Yeah, you just sent it to me.
Yes.
Hmm.
Can just check this.
Okay, do I have to go through them?
Just
Doctor, we'll take the session forward now.
Very good afternoon, all of you. I'm Dr. Pooja Jagannath, consultant physician at Sparsh Hospital, Infantry Road. It's a post-lunch session. I hope to keep you all awake for the next 15-20 minutes with a leading problem in our young society nowadays, which is high blood pressure. Today being World Hypertension Day, this is an initiative Sparsh Hospital has taken to counsel all of you regarding the work balance and the health issues that could affect all of us. So taking this forward, let's see. So let's proceed. Just a minute.
Yeah, doctor, we can proceed. Requesting you to please share the slides in the slideshow format.
Just a minute, huh?
Just next to the negative sign at your bottom of the screen, right side, there is a small icon for slideshow.
My IT person is doing it, actually. I'm not
Okay.
good at it. This one, loading that. 1 minute. That's it. Which was the icon you said? Right bottom, na?
Yeah, right bottom, just next to the minus sign.
Yeah, that's
Yeah.
that. No, next one.
The next one.
The cup sign, isn't it?
Yes, the last one. You can change it right away also. Just click on the last icon that you see on the screen now.
Now that one.
Yeah. Yeah. Done. We're good.
Okay. So am I audible?
All clear, doc.
Yeah. Fine. Screen is visible, no? Yeah. Can you see me?
Yes, the screen. Yes, the screen and your video, audio, everything is perfect.
Okay. Done. Yeah. Can you take this out? Like 1 minute. So hypertension is the leading cause of global disease burden. And we have more than 1 billion new diagnoses per year and approximately 9.4 million deaths per year. These are staggering numbers. So we need to sit up and take cognizance of hypertension. The International Society of Global Hypertension has given us certain cutoff criteria to classify people as normotensive, hypertensive, high normal, and really hypertensive. So routine blood pressure reading of a 130 by 85 would still be normal blood pressure. Of course, a lot of variables with age, gender, etc. We'll get to that later. A high normal blood pressure would be up to 139 by 90. And a grade 1 and a grade 2 hypertension would be 160 by 100 and more than 160 by 100. So the criteria for the hypertension based on office, ambulatory, and home blood pressure measurements are in the slide, as you see. So in the doctor's office, if a person's blood pressure is showing greater than 140 by 90, that would be considered hypertension. And a ambulatory blood pressure, which would be for a 24-hour period, 130 by 80, and a daytime average of 135 by 85, and a nighttime average of 120 by 70 would be more than high blood pressure. And a home blood pressure reading showing more than 135 by 85 would be a reading for consideration by the doctor. BP measurement, though routinely done in most clinics and OPDs and hospitals and casualties, needs to be done on a very strict, background there. It has to be a quiet room, and the person should be comfortable. No smoking or any caffeine or exercise 30 minutes prior to the reading, preferably with an empty bladder, and relax for 3 to 5 minutes before the blood pressure reading is taken. So you don't run into the doctor's office and immediately get a blood pressure, and invariably comes higher there. So you relax for 3 to 5 minutes and then ask the nurse to check your blood pressure. It takes at least 3 measurements at 1 minute intervals to give us the average BP, if even one reading is showing a higher reading, and use the average of the last 2 measurements, not the first one. So ideal situation would be the back supported and no talking between any measurements, and the cuff size according to the body size, and the arm should be bare and resting on a table with the mid-arm at the level of the heart. Of course, the validation of the BP cuff and the machine is mandatory there, and the feet flat on the floor. That is. So sharing with you some demographics about the prevalence of hypertension. We have a 28.5% prevalence, out of which 27.9 people are aware, percentage of people are aware that they are hypertensive. And there are 52.1% people on treatment, out of which 44.4% are in control. So that is a lacuna of 1%, 1.5% of people not even aware that they are hypertensive. And out of the people who are on treatment, almost 6 to 7% are not in control. So it being World Hypertension Day today, the theme for us today is measure your blood pressure accurately, control it, and live longer. If you see these bar diagrams, the National Monitoring Survey says that urban women have a higher prevalence of hypertension compared to rural men and women. And the numbers that are being diagnosed day by day, that is the newly diagnosed hypertensives, again, are much more in urban men than in rural, and much more in urban women than in rural women. But overall, the incidence, even in the rural areas, is increasing. That goes to show that the urbanization of the villages and the tier 2 and 3 towns has caused increase of hypertension in our society in general. So the age group that is the most prevalent with hypertension is the 45 to 69 years. And amongst them, the numbers that are going up depending on newer diagnosis is again the same age group, 45 to 69 years old. So the awareness, treatment, and control of raised blood pressure among those with hypertension is the key implications to achieve global and national target. And this would be a 25% reduction in raised blood pressure by 2025. So we have a year by which we need to be reducing 25% of what the prevalence is today. The way to do this would be with a regular check on blood pressure, leading to early detection, timely management of hypertension, and which would in turn prevent risk of stroke, heart, and kidney diseases. There should be adherence to prescribed treatment, which helps in blood pressure control. And we all need to adopt a healthy lifestyle, decreasing the risk of developing high blood pressure. Causes of hypertension. Hypertension is of syndromic presentation. It could be renal or renal vascular disease. We have two categories, primary or essential hypertension as it was known, which is preventable but not curable, meaning to say that it is associated with modifiable and non-modifiable risk factors, usually polygenic in origin. Whereas secondary hypertension is curable but not preventable in most cases. It would happen because most of the cases would be monogenic here. A high blood pressure reading could be due to the various risk factors as shown to you here on this slide. Firstly, the gender, men having the more chance of higher blood pressure than women, obesity, low physical activity, age, the genetic component of that individual, excessive salt intake, alcohol intake, smoking, and excessive stresses. So all of these could combine and predispose an individual to a higher blood pressure reading. What are the effects of a high blood pressure? There could be an increased risk of heart attack and stroke. There could be an increased risk of kidney damage. A person could present with vision problems. There could be sexual disturbances, peripheral vascular diseases, and one could present with a hypertensive crisis, which could be a blood pressure above 200 by 120, leading to ICU admissions and so on and so forth. So what are the treatments for high blood pressure? First and foremost would be lifestyle modifications. And this table summarizes the effectiveness of various lifestyle modifications if we implement them, and they will lead to a reduction in the systolic blood pressure. So if one indulges in more than 30 minutes per day on most days of the week of any kind of brisk physical aerobic activity, then the blood pressure reduction would be almost up to 9 millimeters. If one consumes a diet rich in fruits, vegetables, with low fat and dairy, reduced saturated and total fat dairy products, up to a 14 mm of blood pressure reduction could happen. The DASH eating plan is the dietary approach to stop hypertension. So any diet which is rich in colored fruits and vegetables and low in whites would help in reducing blood pressure. A diet low in sodium would reduce blood pressure by almost 8 millimeters. So the intake of a maximum of 100 millimoles per day, which is equivalent to 2.4 grams of sodium or 6 grams of sodium chloride. Moderate alcohol consumption is conducive to reduction of blood pressure by up to 4 millimeters. So a woman is allowed to drink maybe 1 drink a day and a man 2 drinks a day. A weight loss with a BMI of almost touching 18.5 to 24.9 kilogram per meter square would lead to the maximum reduction in blood pressure. So 20 millimeter mercury of drop in blood pressure would be accounted for by 10 kgs weight loss. Stress reduction with any kind of modality such as meditation would help in reduction of blood pressure by 5 millimeters, and stoppage of tobacco with whichever modality of choice would reduce blood pressure by almost 4 millimeters of mercury. Now coming to the pharmacotherapy, which is our job. The treatment here for grade 1, grade 2, and grade 3 would be hospital-based, clinic-based. The role that all of you have to play would be at the level of the lifestyle intervention, reiterating, stop smoking, regular exercise, lose weight, salt reduction, eat healthy and drink healthy, and lower alcohol intake. So despite all of this, if someone presents to us with a blood pressure of 140 to 159 by 90 to 100 millimeters of mercury, again, the physician will reiterate that you have lifestyle interventions. And despite that, if the blood pressure is high, we start people on antihypertensives if they are in the high risk category, which would be risk for coronary vascular disease, kidney disease, diabetes, or other organ damage, and patients in the age group of 50 to 80 years. And we start therapy for all the others who present with a high BP despite 3 to 6 months of lifestyle intervention. And grade 2 hypertension is a clinic reading of 160 by 100, more than that, and we start drug treatment immediately. Of course, I re-emphasize that lifestyle intervention goes on all through with pharmacotherapy. So the drug therapy steps is relevant for the physician treating. We start with a monotherapy, and then as and when the dosage needs to be stepped up, we'll add in new drugs depending on the ethnicity and the background of the patient. So coming to the last slide, here it is. It says very aptly, high blood pressure, high cholesterol, high blood sugar, and high anxiety. So getting high is no fun anymore, according to this patient, which I agree totally. Thank you so much for your patient hearing. Do you have any questions?
Thank you so much, Doctor, for such a beautifully put together presentation. We do have some questions that we'd like to take. How often should one check blood pressure?
Okay, again goes into the age group of the patient. Let's take a cutoff at 40 years of age. But nowadays, with pre-employment and people getting into corporate jobs by around 25, by default, most of them would have had one reading at the pre-employment setup. And the red flags go up right away, right there. So if ever in a person's history, a BP reading comes up higher, so that person's protocol of checking blood pressure is very different from routine. But otherwise, anybody between the ages of 25 to 40, getting one BP reading even in a year is more than enough. But above 40, once in 3 months would be better, so that we don't miss anything.
Okay, thank you, Doctor. Another question is it safe to exercise? I mean, is there a limit when you have high blood pressure?
Certainly is a limit, and depends on the drugs that the person is on. If the person has been diagnosed with high blood pressure and been told to just follow lifestyle modifications, I would say intense aerobic activity, lifting weights, we need to put a cap on it. You wouldn't do more than what has been specified. But if you're on medication and your blood pressure has been under control for the past 3 months at least, then certainly guided exercise is absolutely fine. No problems.
Thank you, Doctor. How does alcohol consumption impact BP?
there is even two ways that it impacts. Directly, it acts on the arterial system in the body, but that is for people who've been consuming alcohol over a longer period. Acute ingestion with binge drinking can cause sudden rise in blood pressure, even in youngsters. So both of this should be avoided. A regular alcohol consumption daily of more than 180 ml per day puts a person into higher risk easily within 5 years. Whereas binge drinking that teenagers and youngsters are doing nowadays, that could land them into the emergency room even with one bout of drinking, if it is more than 250 ml of alcohol at that instant. So certainly alcohol consumption has a direct consideration with blood pressure.
Right. Are there any specific recommendations for managing hypertension in women?
Most certainly, most certainly. Again, depending on the age group, you have most women are protected with high blood pressure, from high blood pressure rather, as long as they have a healthy menstrual cycle going on. What I mean to say is perimenopause is when the first signs of high blood pressure will creep into a woman's history. So around that time, yes, regular exercise, maintaining optimal weight, and if she's been smoking, she needs to cut it down, and if she's been on any kind of hormonal pills, she needs to cut those down. Better management of her diabetes. But otherwise, a woman who is between 45 and 55, that is the perimenopausal and premenopausal woman, is more prone to high blood pressure. And once she attains menopause, her risk and the risk of a man of the same age is the same. So the estrogen and progesterone in the woman's body are actually protecting her from high blood pressure. So once she's menopausal, she is also exposed to a risk of high blood pressure. So before attaining menopause, it would be better to attain optimal body weight, cut off the alcohol and the nicotine if there is too much of it, better control over thyroid and diabetes, and regular exercise and low sodium diet would help her get through this phase.
Right. Thank you so much, doctor. What are the risk factors for hypertension for somebody who is aged between 25 to 35? Because nowadays, I think a lot of people from this bracket of age is also having issues with hypertension.
No doubt, no doubt. Smoking, and a lot of them would not even know their cholesterol levels, but a lot of them, because of the the saturated fats and the trans fats and a lot of the junk food eating, are presenting with very high cholesterol levels, which itself is an indirect risk factor for high blood pressure, because they are deposited within the arterial walls at a younger age, and the arteries get stiffer and stiffer as they age. So then the blood pressure comes up much earlier in these people. And of course, the very, very high stress life with the sedentary lifestyle. So I would say that lack of exercise, more of junk eating, and yeah, and basically the stressful scenario in which they live, the high pressure jobs that most of the corporate world is under these days, that's causing a higher risk factor for this age group.
We have another question. Just a minute, it's in the chat. Sleeping disorder, can it cause hypertension?
Absolutely. You don't sleep well and you end up having hypertension. It's very well known. We call it obstructive sleep apnea, but that happens in people who snore, and that happens in people who are morbidly obese. So the point again is it's an indirect circle there showing that obesity can cause hypertension, and obesity, which causes poor sleep pattern. Your REM sleep pattern is disturbed, and so you wake up in the morning with chances of having more chances of having hypertension and stroke. So yes, poor sleep leads to high blood pressure. Certainly, certainly.
Thank you, doctor. We'll just wait for a couple of minutes for any more questions.
Sure.
Do you have any suggestions for people who work in the second shift, who work, stay up till 4, 5, and their lifestyle?
Yeah. The 6 hours of sleep that are lost between 11 and 5 a.m. Affects digestion very profoundly. And it's also known to increase risk of breast cancer in women. These are all documented studies that happen. So, lot more hydration. They tend to get hydrated much more. And certainly take more frequent breaks. But yes, the night shift is more riskier for developing any of these lifestyle illnesses. True holds true for hypertension, holds true for poor gut health and obesity. And women have a lot more hormonal issues because of staying awake during the night. So yeah, suggestions would be to, I mean, someone has to man those shifts, but otherwise, yeah, take frequent breaks as usual, drink more water, and apart from that, don't eat at the beginning of your shift and maybe when you get off your shift, not in the middle. So eating at 2 a.m. and eating at 3 a.m. would not be advisable at all. So your whole
To
circadian rhythm gets disrupted. See, as you enter your shift, you need to have finished your dinner, and a lot of times the early morning meal is totally skipped. So all of this leads to a lot of insulin resistance, leads to early onset of diabetes, and at later age, certainly blood pressure creeps, and they all go hand in hand. The hypertension, the diabetes, the obesity, all of it goes hand in hand. So yeah, if it's not avoidable, then it's better that rest of the day, at least there is 2 hours of rest in the afternoon. And beyond that, hydration and exercise. That's about it. Can do.
to add on to the question, doctor, what are the food intake suggestions for night shift people? Is there a particular diet that they could follow?
Certainly, low salt for everybody universally, as we saw. Sodium restriction certainly helps, and sodium a diet rich in sodium, which would be chips or nachos or a pizza. All of it, any cheese would have a lot more salt in it, and salt in turn causes dehydration. So both of them are very bad for the blood pressure. So I would say low salt. Easily digestible foods are better because you have to sit up. And as I earlier said, the whole gut is in a questionable situation because your whole rhythm is changed. So, yeah, curd based, yogurt based foods, which act like probiotics. So, I'm saying, very typically South Indian, even curd rice would be good to start off. Maybe you're starting your shift at 10 or 11, and then you finish your curd rice dinner at 8 o'clock. If you're not diabetic, then that makes sense. And you get off in the morning. Don't start your day with the very, very black coffee. Drink water, then maybe have a juice, and then start off with your breakfast. But don't go back home and just go to bed. Eat something and then sleep.
Thank you so much, doctor. I think we can wrap the session. Thank you so much for sharing such deep insights and guiding us towards hypertension. And thank you for taking charge of the session. I just got to know about Dr. Pooja too.
Yeah.
So thank you for stepping in and guiding us on such an important topic.
Thank you. Thank you. Yeah. Bye.
Thank you. Bye bye.
Thanks. Bye bye. Thank you.